We're just waiting for Paula to hop on here, and then we will get started. Here we go. Hey.
Good morning.
How are you?
Hi. Good. I'm Paula. Nice to meet you.
Nice to meet you. I'm Allie.
Hi,
Thank
Allie.
you so much for hopping on a little Zoom chat with me.
Absolutely. My pleasure.
I'm so excited.
I know you're local here in Denver.
So I'm up in Blackhawk, but I service Denver. Yeah.
Oh, wonderful. I bet it's beautiful up there in the mountains.
Yes, it is. Loving it.
Yeah. Do you like being away from the hustle and bustle?
I do. Yeah, it's been pretty interesting now that I'm getting busier in my practice because there's a lot of driving. I feel like I live out of my vehicle.
Yeah.
But being able to retreat up here and just like be away from like traffic and the city life is really nice.
Yeah. So you're a doula?
Mm-hmm.
And how long have you done that?
I've been a doula for about 4 years.
Wow.
Yeah.
Do you love it?
I do. Yeah, it's the most fulfilling work I've ever done. Definitely my passion work, which feels really good.
That resonates with me. Very similar to what I do. Absolutely.
Well, I would love to hear what you do. Do you want to go ahead and introduce yourself?
Absolutely. So I am Paula Worth. I live here in the Denver metro area. I'm actually in Littleton.
Okay.
So a local Denver metro girl. I have 2 girls of my own. They're teenagers now, which is hard to believe. Well, yeah, 12 and 14. And really where I'd like to start, just kind of explaining my story and what brought me to do what I do, is telling you that I had easy pregnancies. My husband and I, we got married. I wanted to have a baby. We tried to have a baby. I had a baby. It was just as easy as that. I had an easy pregnancy. I said, let's do it again. Let's try to get pregnant. We did. Another healthy pregnancy, another baby. And I was still young. I was 29 years old, and we felt very complete with our family. So this was back in 2009, after my second daughter was born. I started researching maybe being an egg donor, which I didn't know anything about it at the time. I didn't know I would be on the higher end of that age, acceptable to be an egg donor. I just felt this need to help other families because I was still so young in my reproductive years, just being 29 years old. I come from a very large family, there's 6 of us. So I have 5 brothers and sisters. So, having a lot of pregnancies and, just big families, it was just part of life and how I grew up. So I started researching maybe being an egg donor, and I actually found ConceiveAbilities. And we had just started our gestational carrier program, or our surrogacy program at that time. So I thought this is what I want to do. I really didn't know much about it. I had never known anyone who did it, but it just kind of called to me. And I looked at my husband and said, I could do that. I could carry a baby for someone else. Like, this is something my body does well. I could totally do that. And he said, okay. And so we applied and just really hit the ground running. So I know one of your questions was, what is a surrogate? Right. So we use the terms surrogacy and gestational carrier interchangeably through our work. If you want to get really technical, a surrogate, traditional surrogacy would really be, if a woman uses her own egg, has, sperm that goes into her and then gets pregnant and gives away that child. We don't do that here at ConceiveAbilities. But surrogacy is just the term that, in the media and in the mainstream, everybody knows and recognizes as far as surrogacy. So technically what we do here and what I've done is be a gestational carrier. So really, science behind that is you have no genetic relation to the baby that you're carrying. It's either, we call them intended mom and intended dad's sperm and egg, or they've used a donor. Maybe they've used an egg donor to create their embryo. Maybe they've used a sperm donor, but you have no genetic connection to the baby. So that's gestational carrier, and that's what we do here. I went forward and did my first gestational carrier journey. And then I loved it so much. And then, it wasn't even a year after I delivered, and I thought, yeah, I could do that again. And so I did.
That's incredible.
Yeah, I did. So I had a singleton delivery. I did it again, had another singleton delivery. And then I had the awesome experience to come and work here and help families and just continue in this wonderful work. And then while working here, I had the opportunity to do one last journey, and I carried twins.
Oh my
with
gosh.
with that last delivery that I did.
What was the difference
between
carrying a single baby and twins? Yeah.
Right. Great question. I'd get asked that a lot. Some of our gestational carriers that I work with, carry twins, and I can say, oh, I know about that. I've done that. The biggest thing for me is, of course, I got bigger. My stomach was twice as big, measuring twice as big as it was for singleton, a bit more tired, and lots more appointments.
Gotcha.
Yeah. So it was, you have your regular OB appointment, and then, you're also going to see maternal fetal medicine. You're also going to have lots more ultrasounds. But we were so lucky that everything was completely healthy. So it was just really extra checks and balances to make sure babies were developing. And I did have a C-section.
Okay, that was my next question.
Yeah, I would have loved to go for vaginal delivery. I mean, I had 4 very uncomplicated vaginal deliveries with the singletons. So I'd really hoped, even though it was twins, I'd really hoped for a vaginal delivery. But that baby A was just transverse and just did not want to go head down. And I did my downward facing dog. I did everything that I could. Yeah, he even flipped once, when I was doing the down dog. I was doing it for as long as I could without passing out. And he did flip. And so I do tell people, I'm like, I swear that works. I mean, like a permanent fix, but I swear gravity, kicked in, and that does work.
Oh yeah.
But then he flipped back again and was just transverse, hanging out like a hammock. And so we had a C-section.
So I'm really curious about the emotional side of all of this. Yeah. Like you've had your own kids, and so you know what pregnancy is like, but carrying somebody else's child and being so connected to them, and obviously like you wanted to do this amazing thing for other families, so there's obviously good intention there, and you're doing this right, but were there any emotional things that kind of went along with that, and how did you kind of deal with that? And did you have communication? Were you in communication with the families that you were helping?
Yeah, great questions, and ones that I get asked a lot, because I speak a lot to my personal experience when working with all the intended parents and gestational carriers. When you start this process, there's just a different mindset psychologically going into it, and it's something that we speak about throughout the whole process. But really, it's part of our screening process at the very beginning. You meet with a licensed counselor, you do a psychological evaluation, you talk about being able to separate. Yes, you're going to be attached to this baby, but no, it's not yours. So how are you going to feel about that? How are you going to handle that? So from the very beginning, it's something that you're counseled on and is discussed in depth. And then throughout the process here at ConceiveAbilities, we have counselors that do monthly check-ins. So we have lots of support for our surrogates. We have an online Facebook group where they talk to all their peers. They have monthly support group with a licensed counselor. They do one-on-ones. There's extra check-ins if needed. So it's talked about throughout the whole process. Do you have enough emotional support? You know, do you feel emotionally supported? And I definitely did. You know, having gone, through the process myself, I can speak to, it was discussed at the beginning that this is going to be different from your own pregnancies. You know, it's discussed between us here at the agency. Then you go to the IVF clinic and you do their clearance. And it's not just medical, it's psychological there too.
Sure.
So they talk to you, they'll have you meet with their psychologist to talk again. And, you do testing. I had to do lots of bubble tests and make sure, psychologically, am I in a good place? Am I, do I have that mental health to be able to do this? And then really, it's just the best way I can describe it is it's a little bit like a glorified babysitter. From the very beginning going in, this is different, and you're not preparing like you would for your own baby. You get to whatever month you're comfortable with your own baby, and you're doing the nursery. You're buying clothes. You're buying, you're researching what's the best baby gear and this and that. You're not doing that this time. So the whole walk is different. You may be giving advice to the intended parents that you're caring for, like, hey, when I had my baby, I loved this baby Bjorn, or, you're maybe helping walk them through that, but you're not doing it yourself. There's a very different mindset. So I'll speak to myself first. I did not have any emotional attachment to the baby. I had this like euphoria of, I felt like I had a superpower when I delivered, because like the first time that we did this, we go into the hospital and it was a couple that we were working with. They had no children, and we go in and we leave a day later. And, my husband and I are looking at each other before we checked out the hospital, and we're like, we did that. We created a family. Yeah. There was a couple, and now there's three, and it's a family. And it's just like this, type of moment, where you're just like, here you go, here's your baby. And so emotionally, I didn't feel attached at all to that baby. I felt just elated that I could help them, that I could do that. If anything, I would say that's very consistent with, most of the gestational carriers that we work with as well. That's usually what we hear afterwards. If there is any kind of emotional attachment or sadness after delivery, it's usually tied with the fact, but I know you kind of already asked this, that your relationship that you've had, this closeness that you had with this couple, is going to change after the baby comes. And organically, it should. Their needs to be on their baby and their new family. But you had been such a daily part of their lives, because they're kind of like watching you like a pot about to boil. And comes, and then everybody just kind of goes their own way a little bit. So sometimes, the surrogates can feel a little bit of sadness because they're not texting you 4 times a day.
Right.
To check in on the relationship. And that's how it should be. And I talk to, my clients about this, to say, that's what you want. It may not feel like it at this time, but you want them to focus on this beautiful life that you created for them. And then now you have the opportunity to set up, what does this look like going forward? What's your relationship now? And for me, I had 3 matches, and every one was different, after delivery, for like how often, we keep in touch. One of them, it's more Facebook, and then attending a birthday party once a year. The next set, it's more like once a year. They're very East Coast, fast paced, lots going on. And then the last couple, it's even closer. They live local here in town. They want us to get together. They want to send us pictures. So it's just going to develop organically after the delivery, but it should and it will change after the delivery. And sometimes that's a little saddening and a little hard to wrap your brain around when you have a little bit of, that come down from all the hormones after pregnancy. But in the long run, I mean, that's what needs to happen.
Yeah, absolutely. And I'm curious how you took care of yourself after you had the
Mhm.
babies.
Yeah.
How did you support yourself physically during the postpartum period?
Yeah, that's a great question. And one that I think is not talked about
Mhm.
often enough, right?
Yeah,
In your line of
absolutely.
work.
Yeah.
Yeah, I'm sure you probably have some really good tips that I would have appreciated, and and most pregnant women would have appreciated after
Mhm.
delivery, because I worked with an OB. So you go in for, like a follow-up 6-week visit, and they're like, "You're cleared, you're good." But then if you have emotional things going on or
Mhm.
physical things still going on, where's that additional support?
Yeah,
So I love that you're talking about it. We need to talk about it more. And it's
agreed.
something here at ConceiveAbilities. We've just recently started what's called a 4th trimester for
Mhm.
our surrogates. So after they deliver, we do have extra resources, extra
Oh,
check-ins, extra support for them.
that's
Maybe
great.
you need to be referred to a physical therapist. Maybe you need to, physical therapy for this, that, and the other, after delivery. Or, maybe you need to see a counselor because, emotionally you're feeling like you need to check in with someone. So
Mm,
we've just started doing that because there's a need for it. So
absolutely. That's amazing.
yeah. So me personally, I had a lot of support
Mhm.
going through this process. Um, I like to move my body. I'm
Mhm.
one that, I need to exercise to feel good mentally and physically.
Yeah.
So through both of the vaginal deliveries I had, I stayed working out the best that I could, whether
Mhm.
that's even just walking. I love to do yoga,
Mhm.
anything that just helps me get in tune with my body. I
Sure.
tried to do that as much as I could through the pregnancy. And
Mhm.
then I tried to stay doing that as much as I could after the pregnancy too.
Yeah.
And then for emotional support, of course, I had the agency, I had my support group, I had my peers that were
Mhm.
also going through the process who really understood anything I was feeling or needed to talk through.
Yeah.
They were there to help support that because we do support group past delivery too,
Okay.
extra
Mhm.
emotional support. Um, and then, truth be told, it was harder for me after the C-section, though.
Sure.
Having never experienced that before, I didn't know what to expect.
Yeah.
And it
Well,
is,
especially you being such an active person, you can't
Mhm.
really move in the same way.
That's just it. And to be honest, I didn't feel like myself again
Mhm.
until I kind of got that clearance. The OB's like, okay, you're good. Your scar looks good. You can start working out again. I didn't really feel like myself until I could have that physical activity.
Sure.
But in this line of work, I feel lucky in a way that I've experienced that because I can speak to it with my
Yeah.
clients to
Mhm.
say, this is hard and
Yeah.
you're going to have to be patient. And that's not something I was used to doing.
Yeah.
Of course, it was my last pregnancy too.
Mhm.
So being older and having, had a C-section and not just the quick bounce back. I mean, I remember I had my first daughter and it was like a day after I had her and was released from the hospital. I put her in a stroller and I went to the park and went on a 3-mile walk. And, you just bounce back and
Mhm.
you're just active.
Yeah. Yeah. Oh, well, thank you for all of that information.
Of
And
course.
I'm really happy to hear some of your experience.
Yeah.
Sorry, my dog is over here being really needy.
Oh, I love dogs. Can I see?
Wondering, I actually can't move the camera. I'm on
No
my
worries.
husband's work computer. So he has everything like in a certain way. Sammy, it's okay,
Oh,
buddy.
I need attention. This is I need attention.
He's such a baby.
Are
Uh,
you able to work with your patients after delivery to kind of help through any kind of postpartum stuff?
Yeah, so I'm
That's
also a
great.
postpartum doula. So I do birth work, and I usually have one postpartum visit with my birth clients. And then I also have to do postpartum work separately. And
That's
a lot
great.
of that is just being there for emotional support, making sure that they're healing physically, providing warm, nourishing foods, making sure
Yeah.
that they feel supported and just comfortable,
Yeah.
and also helping with some baby stuff here and there. That's not my specialty by
Yeah.
any means. I'm more of like mama care, like let me
Okay.
focus on you. But
Okay.
certainly if they have any questions about like feeding or whatever it may be, I have some
Yeah,
tools in my head and,
that's great.
other resources for them. So
Sure. And I love that you brought up the food too, because that nourishment is so important and
mhm.
such a big piece of the like holistic approach to what's,
Yeah,
going on with you.
yeah.
Again, another thing that isn't talked about enough.
I know there's so
Hmm.
much focus on the birth aspect because it is a really
Yeah,
big thing, but what happens
it
after you
is.
give
But
birth?
yeah, that's just it. It's traumatic. It's traumatic for your body to
Hmm.
go through. And it's beautiful and it's
Mhm.
wonderful. But the aftermath and putting yourself back together and, getting yourself back healthy.
Right?
You know what? That's a nice thing about being a gestational carrier too, is you have that luxury to focus on yourself. When you
Sure.
have your own child,
Yeah.
it isn't about you.
Yeah.
It should be to an extent, but
Right.
it isn't. It's about this new, beautiful life and
Hmm.
what they need and the lack of sleep that you go through and
Yeah,
everything that comes with being a parent.
absolutely.
Hmm.
So when you were speaking earlier, you mentioned the screening process. I'm curious if you could
Hmm.
talk a little bit about that and what that looks like.
Yeah, absolutely. So we have our gestational carriers apply on our website. And we have a really nice tool on our website. It's like a 5-minute survey that you could go on and just fill out quickly just to see if you would be eligible to
Mhm.
be a surrogate. We have a really nice $7,500 bonus right now if you get accepted to be a
Nice.
gestational carrier, which is really nice. Yeah. So
Mhm.
perfect for, a mom who's staying at home and, wants to make some extra income for her family, for her, kids' college down the road, or, set up, funds for your home or anything like that. That worked really well for me when my girls were young. It gave me the opportunity to stay home and earn a little bit of extra money and also focus on them while I did this
Right.
process. So we have our surrogates go on the website and apply. And then we review that and then get back to them to let them know we are going to get your records and we're going to move you through the application process.
Mhm.
So the gestational carriers need to have had at least one pregnancy. And then beyond that, if they want to know if they would qualify, they should just go on and, do that 5-minute survey to see if they would qualify. But then we have them get their prenatal records, their delivery records. We have nurses that review those to see if they would qualify. And then they're going to go through a psychological evaluation, meet with the counselor to make sure, that they have the mental stability to be able to proceed with the process. And then once they're approved to be what we call matched, then we have someone from our matching team that would reach out to them and say, we have a set of intended parents that we think would match well with you. Would you like to meet them? And, tell them a little bit about the parents. So that's what we do through our screening process. And then we do a Zoom meeting with the intended parents, with someone from our matching team to see if it's going to be a good fit. And then once the match is accepted, that's when me, myself, and my team start working with the clients, is after the match is already made. And then from there, there's a whole separate screening process that happens with the intended parents IVF center.
Okay.
I know one of your questions that you emailed over was, did they choose their providers?
Mhm.
The answer is yes and no. So the intended parents come to us and they already have their IVF clinic. They already have their doctor.
Mhm.
And that could be anywhere in the United States.
Okay.
Um, so the carrier doesn't have to be local to that clinic.
Mhm.
Part of what we do is we set up all their travel to get there with them.
Mhm.
So they would, if it's a clinic that's local to them, that's great. We do have great IVF clinics right here
Mhm.
in Denver that our carriers can go to. But if it's a travel match, is what we call it, then they could be, flying out to the IVF center, and then they're going to do like a half-day screening process
Okay.
with that IVF center. And again, they'll do their own psychological evaluation most times. Sometimes a group psychological evaluation that would include the carrier and the intended parents.
Mhm.
And then they're going to do a medical workup. So blood draw, urine analysis, some kind of evaluation of their uterine cavity to see if they qualify to be a carrier.
And for those who don't know what IVF is, can you explain that?
Yes. So that's in vitro fertilization. So that is the process of the lab that will go in and create the embryo. They'll take either the intended mom's egg and the intended dad's sperm and create the embryo in a petri dish, or they'll get a donor. They could get a donor egg, donor sperm, and use those specimens to create the embryo. So most of the matches that we work with, intended parents have already created their embryos and they're just waiting for a host uterus, which is the gestational carrier.
Gotcha. Oh, this is so fascinating.
Yeah, but when they do the actual embryo transfer, it's a little bit like magic. There is a preparation that's involved that my team and I help work with the carrier on. So she does, you go through that screening process that I mentioned. And then once they're medically cleared, we also make sure we put a legal agreement in place. So they'll work with their attorneys, they'll do a full legal agreement. And then once both of those things are all done, then we start preparing for embryo transfer. So they're on medication for about a month that leads up to embryo transfer, which is a big, huge day.
Yes.
Very exciting, but it does take time. It does take preparation. You know, it does take that like 3 to 4 weeks of being on medication, some appointments for blood draw, ultrasound to make sure everything looks good.
Yeah.
And then they go in for embryo transfer to the IVF clinic. And the process, you would be surprised, after all these months of preparation, the process isn't even 5 minutes long. And it's like a pap smear.
Yeah.
It's so quick. And you're laying there and you think, wow, that was it, huh? Yeah, exactly. Okay, we're really done. We waited months and months and did all this just for that.
Let's go get lunch.
That's right. That's right. And then 9 or 10 days later, they have you do a blood test to check your HCG level and see if you're pregnant.
And if you're not, like, I don't know how common it is for it not to work on the first go. Do you try again? And how long do you keep trying until you can't anymore?
Yeah. So, we work with such young, healthy gestational carriers and great IVF clinics that I would say most of the time it works.
Okay.
But sometimes it doesn't on the first try. So if that were to be the case and they weren't pregnant, they would stop their medication, wait for their next cycle to come, and then usually go ahead and start again, provided that the intended parents still have more embryos, and that there's no reason medically that they shouldn't go ahead and try again. And our contracts read for 3 transfers in a year. So usually that's the norm, is they would try up to 3 times within a calendar year.
Gotcha. Cool. And I'm curious, like, about all the fees that go along with it. Does insurance cover that, or do you all cover that? And how does that work?
Yeah. So the portion with the IVF clinic, the intended parents pay that separately.
Okay.
But when it comes to any like local appointments that she has, we have a beautiful called an all-in package that the intended parents just pay one lump sum amount of money to us here at the agency. And it does cover, if she has local appointments, once she's any travel to get, to and from the IVF center, that she needs to go there for medical workup or embryo transfer. And then once she gets pregnant, they pay us just one lump sum amount of money, and we pay for all pregnancy fees out of that.
Okay. Awesome. Sorry, I haven't even been looking at my questions just because things just keep popping up.
Yeah.
So the prerequisites for being a gestational carrier, young, you've had to have 1 child already.
So at least 21 years old.
Okay, gotcha.
And you have to have had at least 1 pregnancy.
Okay. And is there a ceiling to that age range, or does it just depend on the person?
For a first-time gestational carrier, it would be 40.
Okay.
Yeah, but if you've already had at least 1 gestational carrier journey, we have a lot of repeats, gals who want to do this more than once, like myself, who did it 3 times. It can be considered that you do it again after 40, depending on what the IVF clinic criteria is.
Sure, that makes sense. Mhm. And I'm curious if you could talk about all the different kinds of people and couples and families that come to you all searching for a
Yeah,
gestational carrier.
that's the fun part. And that's how I've been here in this role for 8 years. And I'm not even close to getting bored because I'm a people person. You can probably tell. I
Yes.
like talking to people. I like getting to know people.
Mhm.
And though I know this job backwards and forwards, it never gets old because there's always new personalities, a new culture, a new twist because people are people and they're always going to surprise us, right?
Yes, exactly.
So our intended parents come to us from all over the world. So our gestational carriers need to be here in the United States,
Okay.
but intended parents can be from anywhere. So we do have international intended parents, and we have lots of domestic, intended parents. And the criteria is just that their gestational carrier, of course, needs to be here in the United States, and their clinic needs to be here in the United States. And then we set up all the logistics around that. So we get a whole plethora of personalities, of different cultures, different backgrounds. I love working with the Chinese intended parents. They're just so humble and so gracious. And they're halfway across the world and putting so much trust into this person that they've probably never met in person. And just the love and gratitude that they show is just overwhelming. And it's so warm and it's so lovely.
It gives me goosebumps.
Yeah, but we work with so many different personalities. Some intended parents come into the process and they really want to try to control everything. Some are much more laid back and will say, "You guys are good at this. That's why we hired you. We trust you. Just run the process and let us know what you need us to do." So it's a little bit all over the place.
Yeah.
And we do our best to try to customize the process based on what they need. Do they need more touch points? Do they need more handholding? Do they need more education?
Sure.
I think that's the biggest service that we really provide is that education piece because we've been doing this for so long and we know all the ins and outs. If we can educate them, why is this taking a little bit longer? Well, let me explain why, and just help them through the process.
Absolutely. Yeah, it's amazing that you all are there to support as much or as little as the intended parents need, and just being adaptable to all of that. So I'm curious, I'm sure you get a lot of couples who just can't get pregnant. Do you ever get couples who just don't want to be pregnant?
Occasionally.
Okay.
Yep. And they call that social surrogacy.
Okay.
Where there's not a physical reason for the intended mom not to carry. But sometimes it's more of a psychological reason too. And that would still fall under the need for, a surrogate. But yeah, we have a little bit of that.
Do you ever get same-sex couples?
Oh, yes.
Awesome.
Yep. Absolutely.
That's great. I'm really excited. I'm kind of diving into that world, kind of helping the LGBTQ community. So having you all as a resource is really lovely.
Yeah, absolutely. Yeah, it's so fun.
That's great. So I guess the last question I have, and then you can kind of chat about anything else you want to add, is for those people interested in being a gestational carrier, what is the most important thing for them to consider, in your opinion?
Yeah, that's a great question. I think it's really taking the time to consider what's happening in your life at the time when you want to try to apply and seeing if it's something that you can commit to. I mean, it is going to be, in full transparency, it's going to be a year of your life, maybe more. We always hope that the first transfer is going to take, but sometimes it doesn't. So that could, make your process be longer, and just making sure that you can commit yourself to this process because it does give so much hope to the intended parents.
Yeah.
And we really, want to partner with gestational carriers that are in that with us and with them too. If they do unfortunately have a failed transfer, that you're like, I'm here for you. We're gonna try again.
Yeah.
And, I want to move forward with you.
Yeah.
So I think that would be the biggest thing to consider, and just that you have, enough support at home. We as an agency, we're going to provide all that support, that I listed previously, but it's also important that you have enough support at home, that your partner's on board and excited to do this with you also. I mean, from my perspective, you should also be prepared that it could change your life. It did for me.
Yeah.
Time and time again. I mean, as much as I talk about the seriousness and commitment, there's also that other end of it, which is until you go through it, it's hard to describe how it changed my life.
That's beautiful.
It was just amazing. Yeah. It was just really powerful.
I can only imagine.
Yeah.
Talking a little bit about partners. So the carrier's partner, how are they involved in everything? And, how do they kind of fit in to the experience?
Yeah. They're kind of the silent, strong one a
Sure.
little bit. Yeah. Because, I always say they're kind of our eyes and ears, that if something, is going on with the carrier that maybe she's like, oh, I feel guilty, I don't want to, bother anyone or complain about this, that they're the ones saying, no, you need to bring that to, their attention. Maybe they need, extra support at home, or, if they get on bed rest, we have things that we set up for them, lost wages, childcare, housekeeping. But we need to be, made aware that they, need to start that process. So the partners are really instrumental, throughout this process. I know my husband, he was my biggest supporter. Hey, I'm tired, I'm going to go lay down. He's like, that's fine, I'll put the girls to bed. I'll make dinner, and just understanding that, especially when I was pregnant with the twins, 6 p.m. Paula's bedtime every night. And I think that's why I had such a long, healthy pregnancy, because he gave me the luxury of sleep. I could go to bed at 6 o'clock every night and just know that he was taking care of things, and I didn't need to feel guilty. I had my job. I was growing babies. He had his job, he's taking care of the house and the kids. And that's how I was able, to keep those babies in and growing so big to 38 weeks, scheduled C-section.
Yeah, that's amazing.
Yeah, but the partners are really important. They do so much.
Another question that popped up, are the intended parents present during the birth? I know COVID could be kind of a weird thing.
Yeah. Yes, they are. I mean, occasionally intended parents have missed a birth, especially if they're coming internationally.
Sure. Yeah.
But that's not the norm. Usually, so part of my team and what we do at 30 weeks is we set up a birth discussion meeting where we talk about logistics for travel. If they're not local to the carrier, when are you coming in town? We look at her previous pregnancies and say, okay, she always got induced at 39 weeks. Let's have you here before then. So make sure, that you make it. So we do talk through those pieces. We have kind of a plan A, plan B, maybe even a plan C, so that we've talked about everything. But intended parents want to be in the room almost always. Sometimes culturally, they don't.
Sure.
If they come from a culture where they're just more private and maybe it's not acceptable in their culture for the intended dad to be present. So maybe it's just the intended mom that's there. So we do talk through those things and have a game plan for delivery. But I always tell them in every birth discussion meeting, okay, we're going to make this plan, but the baby's in charge. The baby's calling the shots.
They have their
so
own
we
plan.
talk about this. Yeah. Even if there is that planned induction, I know, being a doula, this more than anyone. The baby's in charge, the baby's going to come, and the baby's going to come. So let's talk about some contingency plans.
Yeah.
But yes, usually the intended parents are there. You're not wrong. It is getting trickier with COVID right now. We also do around 20 weeks of the pregnancy. We connect with the hospital or birth center. We work with birth centers too to talk. We send them a list. It's like a 7-page list of questions that we want to ask them for how things will work for delivery to help everybody prepare. And of course, one of those questions is how many people can be in the room for delivery, if it's vaginal, if it's C-section, so that we can help them prepare.
Yeah.
Some hospitals will say one person.
Mhm.
Like that'll get tricky,
Yeah.
right?
Yeah.
Oh, she's like, I want my partner there. Well, yep. And I want the intended parents there. Well,
Right.
yep. And we always try to see if we can make an exception. I
Mhm.
mean, surrogacy is kind of a special situation.
Mhm.
So we do ask, the nurse managers or the director of labor and delivery, could you please make an exception, and let another person or two in there.
Yeah.
But yeah, it's a different world right now.
It is. It's so
Yeah,
weird.
birth centers are great to work with regarding that. They
Mhm.
have so much more leeway
Yeah.
than the hospitals to be able to say, I mean, they're not letting like children in and things,
Mhm.
like that, but just to be able to have both intended parents there and, the gestational carrier's partner, they're like, yes, of course,
Awesome. Yeah.
which is beautiful.
Yes, absolutely.
Hmm.
Wonderful. Let's see. Any other questions? Do your carriers work with doulas ever?
Yes.
Awesome.
Mm-hmm.
Lovely.
Yeah, I do. I had a gestational carrier who just delivered, and she is a doula.
Oh,
So
awesome.
she's so knowledgeable. Yeah, and we were laughing because when I did her birth discussion meeting, she like ran the show. She was like, I'm going to need this, and I'm going to do this, and I'll sit on the ball in this situation, and then I'm going to be in the water, and then I'm going to do this, and then the delayed cord clamping, and then this, and I was like, you are magic. You go at it. I'm just here if you need me. She was
Yeah,
so
totally.
knowledgeable. It was really awesome.
That's
But it
great.
made the intended parents feel so good.
Yeah.
They just had so much confidence because she is the expert.
Yeah.
Like, this is what I do, and she does it well.
That's awesome.
It is awesome.
Well, cool. How can people find you?
Yeah, they just go to ConceiveAbilities.com,
Mhm.
and we have great tools on the website for them to peruse through. We have that quick 5-minute survey I was talking about before, where they can fill it out to see if they would be eligible to fill out our longer application to apply. And we have a calculator. It's a compensation calculator on our website where they could go and put in where they live to
Mhm.
see what their compensation would be should they get approved to move forward. But we have everything on our website.
Perfect. Anything else you would like to add, Paula?
No, it's been really nice talking to you. Do you have any tips for me for when I do these birth discussion meetings? What else should I be asking and coaching, all of my clients through to prepare for delivery? What's the biggest question that you get preparing for delivery as a doula?
I think one of the biggest things is just being flexible and adaptable mentally. Because birth can be, it sometimes doesn't go as planned. Like you can have a set birth plan, but sometimes it just doesn't go that way. And so just being really adaptable, moment to moment, and just staying empowered and body autonomy. So really making sure that you have your support and you're asking questions if you have questions. Yeah, I think that's.
Do you go to birth centers and hospitals?
Mm-hmm.
Okay.
Yep.
That's wonderful. Are you running into any red tape getting into hospitals right now with COVID?
No, and I haven't been, which I'm very happy to be in Colorado because I know that was a big thing in other states. Doulas weren't even allowed in. So a lot of virtual support was happening, and
it's just not the same. Oh my gosh.
It's really not.
You're like, I'm rubbing your back.
Yeah.
Oh, Julie, I'm petting your hair.
I know. Yeah, it's just it's not the same, and so I'm very grateful that I have not been turned down by any facility. There are certain rules in the hospitals. Like sometimes I'm not allowed to like go and get ice and water and things. The nurses have to do that.
Oh, sure.
But I've always been allowed in the room. So
what hospital do you primarily go to?
So I think the top 3 that I work at are Avista in Louisville, Boulder Community, and then Rose.
Okay. Yeah. We have lots of surrogates deliver at Rose. They do a great job with surrogacy.
That's awesome. Very
good. And knowing that you go there too, I'm gonna keep you in mind in case we have clients who ask for a doula.
Yeah, please do.
Yeah.
I'd be happy to support you all in any way.
Yeah. Because you don't have to be affiliated with any specific OB or practice or anything. You're just independent, right?
Yep, independent, hired by the client, and yep.
That's wonderful. Yeah, I will. I'll definitely keep that in mind.
Awesome.
Yeah.
Well, Paula, thank you so much. This
My
was such a
pleasure.
fascinating interview, and I'm really
Yeah.
excited to kind of learn more about you all and
Yeah.
have you in my back pocket as a resource.
Absolutely. Yeah. Same to you. Marcy was asking, will she get to read the blog before you post it?
So I'm going to be posting the video. And then below the video, I'll just have, your website and a couple tidbits, which we covered in the video. So
Okay.
I can send you over the page before I publish it, if that's
Sure.
helpful.
Yeah. Send it over to Marcy and Mike. Thank you so much.
Yeah, thank you.
All right. It's a pleasure.
Have a beautiful day, Paula.
All right. You too. Take care.
Take care.
Bye.